Good morning and good afternoon to everyone. We want to welcome and thank you guys for joining today's The Healthcare Boom Insights for the Patient-Centric Organization webinar. In today's presentation, I will walk you through, our presenters today will be Johnny and Mary Lou, and then I will be walking you through our agenda today. First, we'll be discussing the healthcare boom, biggest trends in healthcare in 2018, where market research can help, and then finally our conclusion, which is the patient-centric health systems. My name is Lisa Lopez. I'm the content specialist here at Fuel Cycle, and I'm very excited to have you with us all today. Before we start, I have a few housekeeping items. We will have a Q&A session at the end of today's webinar. If you guys have any questions at any time throughout today's presentation, feel free to submit them to either the question or chat box inside the GoToWebinar interface, and we will catalog them throughout the presentation and come back to them at the end of the presentation. Also, I wanted to mention, if you haven't joined us before, we have a substantial catalog of case studies, white papers, webinars, and industry resources located at fuelcycle.com under the resources section, which I encourage you guys to take a look at when you have the time. So today's webinar should take about 30 to 35 minutes, and then we'll go into a 10-minute Q&A session at the end. So with that, I would like to introduce our presenters for today. We have Johnny with us, Johnny Anderson. He has 9+ years of experience with social research, technology training, project management, and then collegiate teaching includes courses on gerontology. His research experiences include surveys, IDIs, focus groups, and art-based research on topics such as marketing and advertising for films and political campaigns. And then after Johnny presents, we will have Mary Lou. Mary Lou brings with her 30+ years of experience working with leading businesses to use market research and insights to drive business performance. Mary Lou has led the Global Corporate Relations and Market Development team for the Executive Education Program at Harvard Business School. She has had the pleasure of taking on global responsibilities that have spanned 60 countries across all continents, and now leads the Client Success team at Fuel Cycle as Vice President of Client Services. So, without further introduction, I will hand this over to Johnny, who will be starting out with discussing the healthcare boom.
Thanks, Lisa. Yeah, so there's a lot of elements that, are certainly relevant to discuss here with the healthcare industry, in particular how much larger, and it doesn't seem to be stopping, the healthcare industry has certainly become. So as we're looking here at how the amount of jobs and the level of employment in healthcare has steadily increased, even if we're looking at what happened during the recession in the late 2000s and slightly after. So the amount of people in this workforce age-wise are certainly getting older. And this is due to a lot of effects like baby boomers certainly aging out with a large population boom that happened in the 40s, 50s, and 60s. But when it comes to, one of the bigger elements about why healthcare is continuing to expand, a lot of it has to do with the public support. So we know the U.S. spends billions of dollars every year on, fully public options like Medicare and Medicaid, or government employee and veteran care. But we also subsidize private insurance in a lot of ways, and whether that's through tax breaks for private employers that sponsor healthcare, or elements of the Affordable Care Act for lower income Americans, this wide level of public support makes healthcare employment almost invincible, even during these really bad downturns. And incredibly, healthcare employment has increased every month during the Great Recession. And so when you break down these elements, people are always going to get sick or become ill or at the very least desire new treatments. So healthcare is essentially recession-proof. And if people become more hesitant to seek traditional medical care for financial reasons, this opens up the door for healthcare companies and organizations to get really creative on developing and therefore testing new and cost-effective methods to get patients to use some of these alternative methods and resources. Because what we see now is that we've moved towards a consumer-controlled healthcare system. Patients are really driving the questions. They're the ones seeking out alternative opinions. They're the ones finding information out on their own to make more autonomous decisions. And these health organizations, they're smart. They know this. And I think a huge reason why healthcare clients even have a desire to do research communities in the first place is often to take that mentality and utilize it to, help further shape their organization's goals, whether it's for marketing or exposure, retention, or even expansion. So all this is related to how so many ways healthcare is immune to even things like globalization and automation. We've revolutionized things like supply chains, and we have this global market for labor, but healthcare in most ways still needs to stay local. If there are more people to treat, we can't necessarily hire cheaper labor overseas to handle this influx of customers and patients. Workers often have to be hired within the U.S. So while some processes can be simplified or made more efficient, there always has to be a limit to the amount of automation or outsourcing. So that's definitely a key takeaway here. So some of these big trends that are affecting healthcare in the current year, one of which is telemedicine. So this involves the use of electronic communications or software to provide anything like clinical services to patients that don't require an actual in-person visit. So telemedicine technology is used for things like follow-up visits or chronic condition management, medication management, consultation for specialists, and other clinical services that can often be provided remotely, via secure video or some kind of audio connection. And when we look at the highest usage of age demographics for telemedicine, it is the highest in the 25 to 34 age bracket, and this is across all mediums. And then it's quickly followed by the 35 to 44 age bracket. Baby boomers we see are the least likely of any age group to have used telemedicine, but there's still at least half of them that have sought some form of virtual medical care with a provider, at least through a telephone call. I don't think it's surprising that millennials or the slightly above generation are more apt to use these convenience-based alternative resources, especially since growing up with these potentially developing resources was just part of their upbringing. But as we move forward in the future, accessibility is key for younger patients and consumers, and this demand is only going to increase as the role of technology does. We want this instant accessibility for things like appointments, claims, test results, just the idea of reaching your doctor. I know for my medical plan, I have the ability to hop on a live chat and ask questions to my care provider. You can do things like texting your therapist in various services, mobile form submissions, any elements like this is definitely paving the way. Then we have new advents like wearables, and this is about patient-generated health data. So things like steps and sleep, all these remain valuable data points for clinicians. And so this latest generation of connected health devices is going even further. So these new devices are incorporating medical metrics previously confined to these clinical practices and hospitals. These can measure everything from temperature to pulse wave velocity. So there's a lot of new and exciting opportunities for remote care teams with products like these. So what we are seeing is not just this consumerization of healthcare, but this medicalization of consumer health. So as we sort of see this data begin to flow into electronic medical records, the cost of this remote monitoring is drastically dropping. So a single nurse in the past might have been able to remotely follow, say, 50 patients 10 years ago using a phone, and platforms showing blood pressure or weight data from patients now allows that same nurse to follow 300, even 500 patients once. So this is all about prioritization. As we're looking at the beginning of last year to now, we see at least a quarter of Americans owning some form of these wearable devices, and that's up 12% just from 2 years prior. And we're definitely aware of how some employee-sponsored healthcare plans offer some discounts or even company perks for employees who actually use these products and maintain some certain health standards. So there are ways that private companies are effectively further incentivizing good health. So there's a lot of cool things to be said here. Let me push forward with retail care centers. So the first retail clinics opened in early 2000s, and by 2010, there's, close to 1,200 nationwide. And, recent estimates predict that there's going to be close to 3,000 clinics by, the middle of this year. So nearly double of what's happening in 2014. And these, again, are about convenience, accessibility, especially after-hours accessibility, and, of course, clear pricing. These are the really important drivers of growth for healthcare organizations, and they're really tapping into this market to getting the demand that customers are asking for. And consumers seem to be relatively happy with their overall care experiences at these kind of facilities. And these are all, again, the result of consumer demand. And it's all about, putting the patient at the center of care. Improve that patient satisfaction, and that's what will keep them satisfied with remaining in this organization. So we have things like CVS Minute Clinic and Walgreens Healthcare Clinic, et cetera. And then we take a different, perhaps alternative approach with holistic healthcare. So this is a form of healing that tries to consider the entire body in different aspects. So body, mind, spirit, even things like emotions, in this ideal quest, if you will, for optimal health and wellness. So when we're looking at holistic medicine philosophy, the way to achieve optimal health is by gaining a proper balance in your life, and that's through factors like diet, exercise, environmental measures, our attitude and behavior modifications, even things like spiritual counseling, which can often be secular, so it doesn't need to be a deterrent for some people, and bioenergy enhancement. And, we even looked at a study by the National Institute of Health, and, we learned that about a third of Americans are using non-traditional approaches in their healthcare. And while only 5% are using these alternative methods as their sole method, it's still commonly used. So if we look at products like fish oil, probiotics, melatonin, deep breathing, even things like yoga, they're highly popular amongst new consumers. And I know here at Fuel Cycle, we recently held a company-wide meditation session, and I know it was very well received. And due to that, I know that that's something our executive team is looking to continue doing moving forward. So some good highlights to discuss about the healthcare industry and changes and trends. So moving forward, we'll pass it off to Mary Lou, where she will jump in and talk about how market research specifically can help out with this.
Great. Thank you, Johnny. So what does this mean for market research and insights, customer experience, employee staff engagement? We really need to think about how we can keep our finger on the pulse, pun halfway intended, of the many stakeholder groups. So you have patients or consumers, you have their caretakers, medical professionals, insurance carriers, the employees of all of these firms, a number of different constituencies to really think about. So wanted to go through some different elements that impact how research can support all of the stakeholder groups in prospering in this context. So the first area is emerging technologies. So Johnny spoke about telemedicine and wearables. There's an increasing amount of technology being applied in the diagnosis, treatment, and care areas. So you think about artificial intelligence, machine learning, you think about the ways that scans are being brought to life in terms of augmented reality and data visualization. On the consumer side, consumers have ready access to their medical records, to results, to information in a variety of sources, some of it controlled or managed at least by the doctors and medical professionals that are taking care of them, and some of it information that the consumers are collecting through a variety of sources, not all vetted by medical professionals. With all of this technology and all this information, the challenge really becomes maintaining a focus on the people, whether it's the patients, the doctors, the nurses, the technicians, it's the patients within this. And so from our perspective, the research really needs to break through the clutter of the ones and the zeros of technology and connect with the people, that are behind all of this and that are being impacted with all of this. Now, that said, there's challenges in focusing on the people aspect, because the people haven't changed. As the industry is changing, the people that are directly the customers or consumers of all of this are not changed. So consumers across all industries are increasingly sophisticated, knowledgeable, and incredibly vocal, and nowhere is that more true than in the industry that we're talking about. There's a wealth of information available to consumers now on health and wellness. And as an example, you think about WebMD. It was started in 1996, and recently they reported that on a per month basis, they get close to 180 million unique visitors. That's an enormous number of people that are accessing information on their own, and most of these people are either the consumers interested in their own health and wellness issues, or caretakers for those consumers. Consumers are also shopping for health care. So Johnny mentioned some of the different outlets that have come up, what used to be called Doc in a Box centers, but now they're armed with information and definite opinions on how they want to be treated both as patients and treated as people. And then on the provider side, and I would include insurers with providers, definitely a blurring of the lines in terms of providing insight and care for patients. There are obviously a multitude of challenges. This whole past 12 months, healthcare has been front and center in the United States in terms of how we're going to move forward with healthcare. The great news is that proactively keeping people healthy is good for business. The challenge with that is, with this increasing consumer sophistication and access to information, there's some skepticism about what the incentives or disincentives to wellness care are, and confusion about how to make a decision about what sort of health care to get. And this is true of whether it's over-the-counter sorts of treatments, or whether it's prescription or services provided by a medical profession. It's the consumers behind this paradigm shift of going from medical treatment to healthcare and now to wellness. So Johnny talked a bit about some of the wellness trends, and so you have this mix of people using technology, whether it's wearables or all the technology embedded within medicine now, but at the same time seeking alternatives that are more focused on the wellness piece. And so that just creates a tremendous amount of complexity and confusion in the marketplace, confusion with consumers on really understanding what the best path forward for them is, and being able to access that best path forward. And so research needs to play a very strong role in understanding where consumers are in their knowledge, where they are in their preferences for wellness care, and how to communicate more effectively with them. And then on the provider insurer side, again, a whole lot of information, a better understanding of what role technology can play in building that relationship with these consumers, building up credibility, counteracting the skepticism, and more clearly communicating the recommended path forward. And so we see a lot of opportunity, and we know with a lot of our healthcare clients and clients in associated industries that there is a lot of work being done on better understanding that kind of customer or patient journey, and working on the user experience or customer experience from the customer side, as well as taking a look at what the impacts of all of these changes are to the people that are actually seeking to provide the care and the treatment for these patients. So, Johnny talked about the rise of non-traditional methods, and in his context, he was talking more about what in some parts of the world are the traditional methods of meditation and yoga and spirituality. There's also non-traditional methods that are more based on data, different ways of collecting the data. And so from a market research point of view, a couple of decades ago, all of the research associated with medical care or healthcare was very straightforward surveys, focus groups, things like that, and considered either as a tracker or as individual projects. And you kind of eyeballed the changes or the compared and contrast across these separate ad hoc studies. What we're talking about now is definitely continuous data collection. That's the premise upon which Fuel Cycle was created, and our strength, but also the incorporation of other sources of data. So some of the passive data collection that Johnny mentioned in terms of wearables, other sorts of data that are accessible. And we really kind of bucket these into two categories. One is patient-specific medical data. So if you think about all of the test results from annual physicals and the tests associated with that, specialist tests or screening, family histories, nutritional tracking, some of that sleep and exercise data from wearable trackers, that's all very much a piece of biometrics and medical data. To that, we would add another patient-centric stream, which is the customer experience across the entire life cycle of wellness care. So that includes, all of the becoming aware of the different options, what information and what is the experience like in considering the different options, in making appointments, in, getting insurance coverage, what the interaction is with the office manager, with the nurse or the PA, with the actual doctor, with the billing department, the pharmacy. It's a very complex chain, as you all know. But the customer experience across that entire life cycle really determines whether people have a good experience, whether they continue on that journey and continue and do everything that they need to do to become well and to stay well. And so the integration of the data, and for Fuel Cycle, our focus is much more on the customer experience data, the underlying understanding about what the knowledge base is of the customers or patients, and less so on the medical data. That's obviously very, very sensitive data and has a lot, rightfully so, of legal restrictions around the use and collection of that data. But if we're talking about the customer experience, which is a huge driver in this very customer-centric world we live in now, that is data that we collect as part of our own ongoing work with the communities that we manage that are associated with health and wellness, and the ability to add in some of these behavioral data sources, other data sources that don't touch upon this sensitive or private information, that enable us to have a much more holistic view of the customer experience, enables us to provide recommendations to smooth that customer experience and to really add value to both the customers as well as to the healthcare providers and the insurers that we work with. So it really is about redefining what value means. A lot of people, when you talk about value-centric healthcare, they see value and they think dollars and cents, and there certainly are dollars and cents involved in healthcare. But really, what we're talking about is the value to the customer and the value to to the providers. And that value comes from having this smooth customer journey where there's clarity of information on both sides, and there's a lack of friction and skepticism on both sides. So, what we're really talking about is a shift from this reactive medical treatment to a proactive focus on holistic wellness. And that shift is happening on both the patient and, as we said, the provider sides in terms of a focus on wellness. And so whenever there's a fundamental shift in perspective, there are a lot of questions that come up. So some of the things that we explore on behalf of our clients in this space is, how is this shift to wellness being communicated to the patients, as well as to the providers that are expected to change in some ways the way that they're working with their patients. Questions around what bundle of wellness elements should be part of a benefits package. What's the impact, again, on healthcare providers if we're making this shift? What brands are considered credible in this context? There's a lot of discussion about Amazon partnering and creating their own healthcare system, and questions about, does Amazon have the kind of a brand that would enable it to have credibility? Same sort of question about CVS and Aetna, the impact of the brand on perceptions about healthcare for this very important topic. And then, a fundamental question of, in this, as things change this way, what does it mean to be healthy or well? It's not just the absence of being sick. It's something in addition to that. And so the question becomes, what does it mean to the consumers, to potential patients, to be healthy, to be well? And what does it mean to providers and insurance companies? And is there, how much of an overlap is there between these two definitions that we're creating? So if we think about, as really kind of some closing thoughts about some of the things that Johnny brought up and that we've been talking about, is really the incredible power of patients or customers in this context. The customers really have forced their way into the center of this relationship, not just as a patient who is kind of the object of treatment, but as a customer with a strong voice in the details and direction of their care. And so some of the providers that we have been working with, and the insurers that we've been working with, really have been on the forefront, from our perspective, of learning from other industries that have this heritage of deep customer understanding and being customer-centric. So you think about consumer products, you think about certain aspects of financial services and hospitality, that those industries have a longer track record in terms of learning to effectively target, serve, communicate with, focus on retaining customers and patients. And that's a direction that we definitely encourage and support with our platform. So, as customers continue to flex their muscles in shopping for their own health and wellness services, these providers and insurers who best understand and are focused on the customer experience, we feel will prosper. And we're very proud to be part of the solution for that, with our platform that enables not just all the data to be collected for individual projects that I talked about was kind of the heritage of this kind of research, but really to tie those projects together to form a much more holistic picture of this patient journey, so that we can together optimize it. So those are the conclusions of my thoughts. I think at this point we'd love to see if you have any questions.
Yeah, and thank you so much, Johnny and Mary Lou. I thought this was super interesting and informative. And I just want to make sure to let anyone know that if you have any questions right now, feel free to enter them into the chat box, and I will divvy them out to our presenters to speak on. But we do have one question so far that's come in, and it is from Rachel, who wants to know, healthcare can be a really sensitive subject to try and aggregate data on, particularly when discussing sensitive information with patients. What are some of the ways that we can better understand our customer without coming off as too invasive and at the same time protecting their data and making them feel secure? And what are some of the ways that you have seen insights teams overcome these hurdles? And I will hand this over to you, Mary Lou, to answer.
Okay, sure. So thank you, Rachel, for the question. For us, we really feel that you have to start with a foundation of trust. You can't just start off a conversation with asking this kind of sensitive information. We have the same situation with our financial services clients. You can't start off with very sensitive questions about their finances without establishing a foundation of trust. And so for us, our core business is our research communities, and so we have a very strong focus as we launch a community on establishing that circle of trust. We're very clear with what the community is about. We're very clear about our privacy and security rules. We're very clear about what the acceptable behaviors in interacting are, so that very quickly within that community context, we are able to delve into areas of sensitivity. There are times when we're extending beyond our community, using fuel cycle panels to pull in some additional respondents from outside of the community. And so in that context, it's important for us, again, to establish that trust quickly. And so in that context, again, we have to find a way in that introduction to make sure that they understand our commitment to privacy and security. We also, in whether it's in our community or whether we're using our panels, we make a point of explaining why we're asking these questions. It's you can't just throw a sensitive question out there without context. And so we explain really what the intent of the project is, that we're trying to better understand a pattern of behavior around this so that we can improve this product area or we can improve this service offering. And so if they have an understanding that we're trying to solve a problem that is important to them and to people like them, and we've reinforced our privacy and security rules, then we have very good success in broaching these sensitive subjects with our healthcare clients, as well as financial services and other areas that are sensitive.
Okay, awesome. And then we do have two more questions that have come in. And then I'm going to hand this one over to you, Mary Lou, as well. This one comes from Jim, who wants to know, the presenter indicated patients are satisfied with the retailization of healthcare. Is there any insight into services not yet seen in retail clinics that consumers may be open to in the future?
That's a really interesting question. I think, in the beginning, when the wellness clinics that are typically within a drugstore, for example, were first started, there were a lot of questions about, is that a real doctor? Is that a real, RN, depending on the context. And so I think it took some time to build up that credibility. I think in certain parts of the country, you have more urgent care facilities that are a little bit different from those wellness clinics. And so you're starting to see a little bit of specialization within that kind of retail medical context of, kind of wellness checks, getting the shots for the kids before they go to school, getting a strep throat test, being something that people feel confident about getting in one of the wellness clinics, getting their flu shot, another example, and then having urgent care centers that are kind of a midway point between an emergency room and the wellness clinic, satisfying perhaps some other areas. So I think that's less problematic to communicate to customers, because you can communicate on the basis of what type of medical staff are there. at an urgent care facility, you have you have medical doctors, you typically have x-ray equipment. You can kind of go through and list out the capabilities and the staffing that's there. I think a bigger challenge is happening right now in some of these technology-based services that are providing medical care that Johnny mentioned. So when you have, doing a FaceTime or video sharing with a medical professional to diagnose something and to have a prescription called in, those types of things, there's a generation that is comfortable with everything happening on their phone, and so I think it's less of a challenge for them. But I think once you get beyond that age group and you get beyond millennials, then there is more work, not just what the capabilities and experience of the person that's on the other end of the phone or the other end of your screen, but how is it that they're able to diagnose through video, and adding more richness to that story so that people belong beyond that millennial group have faith in the ability for technology to show what needs to be shown in order to get that diagnosis and prescription.
Okay, awesome. And then we have another question that I'm going to probably hand over to Johnny, and then you can feel free to jump in, Mary Lou. But the next one is from Jim, and it says, in your research communities, what disease types, medical services access, demographic areas, etc., are represented in the community?
Yeah, so I actually work with 3 different healthcare organizations on the communities here, and it sort of spans all across. I mean, we have some very small private-based healthcare organizations. We have some that work primarily with Medicare and Medicaid. And I think, the options are sort of limitless with what they can choose to ask, but I know some of the questions that were addressed earlier is, what to do with that data. So in terms of, having representation, I think it's fully open, but if you are concerned that certain healthcare information like, someone's illness or something like that would be too sensitive to discuss in like a research environment where members can speak to one another. I know one of our healthcare communities sort of limits the member-to-member discussions to, surveys where, they can sort of participate that way. If you want to go about it in a more qualitative fashion, one of my communities does diary studies where it's a lot more private and it's only from the member to the moderator and the research analyst on the client side. So, there's no issue of privacy or anything like that. But I think, in terms of representation, we certainly have, it's very diverse. It just depends on, what the client specifically wants to test, and, any particulars to, that they need to go through in order to how to reach out to them. But I don't think there's a demographic in the healthcare world that we haven't worked with, consumer-wise.
Okay, awesome. And so then the final question that we have that came in, it says, and it's from Zoe, it says, in addition to customer experience journey mapping, how can market researchers help providers better understand other variables that affect consumer choice? For example, family size, special needs, limited expendable income, attitudes and beliefs towards medicine, etc. And so I'll let you take that one over, Mary Lou, and then again, if you want to jump in, Johnny, feel free to.
Yeah, so I think that gets to the data integration piece. So there are certain pieces of information that we can and do collect via surveys, profiling exercises, some of the qualitative work that Johnny mentioned, and some of those other factors that could be driving people's usage, attitudes, and experience with all aspects of health and wellness, or some of those things that you mentioned. So family composition, are there any family members that have medical or other challenges? Some of the demographics in terms of regionality, income, disposable income, those sorts of things definitely have an impact on all aspects of this. And so in addition to the customer journey and the customer experience, which really covers everything in our minds. You can parse that out so many different ways. There are a lot of other factors that can be explored within the context of market research, and for us within a community context of understanding, pricing points, understanding other benefits that might help from a wellness perspective that aren't considered typically part of health insurance. A lot of testing of communications of various types of how does this work. We have one community that is filled with office managers because there's a whole range of things that an office manager is expected to handle now that wasn't true in the past. And so, we really, you can think about health and wellness as kind of just another service industry. And so any type of research that we do for any of our service clients, has an allegory or an analog within a healthcare setting. There are these other layers that some of which you identified that provide additional context as we take a look at it, so that within our platform, if we've collected data already on family composition and we know that there's a child in the household that has an ongoing medical challenge, that we can, in a survey that we do 6 months down the road, we can still cross-tab on the basis of that information that we collected before and say, let's take a look at households where they have an ongoing, medical challenge among a family member versus those that don't, and see what their reaction is to this new service offering. Perhaps it's related to the last question, related to, some of these services that you can get in either a retail context or an online context, understanding whether people who already know they have a medical issue are more or less likely to be interested in something like that, or would be more skeptical. So for us, more data is more better, and we want to collect, as many data points that way as possible, because we want to do analytics and really understand what some of the triggers and drivers are for people having a good experience or a bad experience, or people interested in a certain service offering and people who aren't.
All right, perfect. Well, thank you so much, you guys. I think that's all the questions we've had so far. If anyone does want to submit anything, we can always feed it later into Johnny or Mary Lou to answer privately. But yeah, that was a fantastic webinar, super informative. And we just want to thank everyone who was on the line for joining us. Yes, so thank you.